Hello, everyone. My name is Mike Hess, and I'm Senior Director of Public Outreach and Education for the COPD Foundation. Welcome to today's Facebook premiere event, where we are marking the first ever World Bronchiectasis Day. We're here to help teach everyone how to live well with this condition, and in order to do that, we've invited someone who knows a little bit about living with this condition, living well with bronchiectasis. I'd like to introduce Katie Keating. Katie?
Hello, I'm so excited to be here. It is exciting times to be celebrating the first annual Bronchiectasis Day.
Indeed. So thank you for spending some time with us today, and I'm really looking forward to this conversation.
Same here.
So first off, I'd like to rewind all the way back to the beginning. Can you tell us a little bit about the symptoms you experienced very early on and what led to your diagnosis, and maybe a little bit about what you think caused your case of bronchiectasis?
My symptoms began many years ago. Initially, I had NTM infection followed by several gram-negative and Pseudomonas infection, which I believe led to my bronchiectasis. The symptoms are coughing, fatigue, weight loss, shortness of breath on exertion, etc. I just realized how important it was to learn more about preventative measures to keep the condition from getting worse. If you do the preventative measures, the bronchial hygiene, it's similar to like dental hygiene. Doing airway clearance, you could compare it to flossing your teeth. If you do it on a regular basis, you clean your lungs so that you don't have a breeding ground of a lot of mucus so that germs can multiply, and it lessens the chances of the inflammation within your chest. So I try to educate myself and learn as much as I can. Many of us have an issue with the cilia that line the airway. They become damaged when you have bronchiectasis or are missing. And if we don't do good airway clearance to bring up the mucus and bring it up and out, then we are setting ourselves up for further infections, inflammation, and damage. So we just really have to be proactive, and we can live a good quality of life if we take the bull by the horns and do what we need to do.
I love that attitude. So you mentioned this phrase, airway clearance, a couple of times, along with bronchial hygiene. That's a phrase that comes up a lot when we're talking about bronchiectasis, but it's something that people may not be very familiar with. So can you tell us a little bit about your experience with airway clearance and how important that really is to managing your day-to-day symptoms?
It is so important. Otherwise, you're really setting yourself up for long-term respiratory issues. They are very simple, portable devices that you hold in your hands. You take deep breaths in and blow out. And it just helps the movement of the mucus upward and outward. Otherwise, the mucus stays stagnant in your chest. So these devices are like something that helps bring the movement up. And then you do some deep breathing or have coughs, and then you're able to expel it. Some people will do these airway clearances and still have difficulty, but for many patients, it really helps them. And if you are more clear, then you're less likely to have that breeding ground for germs, bacteria to multiply, to grow, and then end up going to the doctor's office with an infection and inflammation. So if you are proactive instead of reactive, you will really have a better quality of life. And a quality of life is so important for all patients who have been diagnosed with a rare disorder. Well, it's not as rare as it was in the past, but there are ways that we can be proactive and lessen the chances of worsening of symptoms.
Absolutely. So this airway clearance regimen that you're on, how did you come to integrate that into your daily routine? I'm assuming this is something you do a couple of times a day. You mentioned flossing a couple of times a day, so I'm assuming that this is something that kind of gets built into your
Yes.
lifestyle.
In the morning is when most people have the most sputum because you lie flat at night, and by gravity, you accumulate sputum, even though a lot of us have the head of the bed up because of reflux issues. They recommend to have the head of the bed up. But in the morning after I drink some water, I do my handheld device as before I check my emails, and you just need to establish a little routine that works for you, and it doesn't take that long. And then do it in the evening, after you watch the news or whatever activity you do in the evening before you go to bed. It just helps bring up mucus. Some people, when they're really in the acute stage and really in the infectious stage, you may do it more often because, again, you have more mucus in your chest and you just want to bring it up and out. You have to develop habits. So if you realize that it's really going to be beneficial, then you will find a way. And that's what we're all here for, to try to promote everybody to do everything you can so that you could have the best quality of life, because we design our lives and we're all here to support everyone to do so.
We design our lives. I really like the sound of that. That's fantastic. So switching gears a little bit, now that we've talked about airway clearance, once those airways are clear, once you get the air moving pretty well again, how important are things like exercise to people living with bronchiectasis?
Exercise is so important, just building overall strength within the body. And it just exercise, the deep breathing when you exercise also is similar to airway clearance, because it helps bring up the mucus. If it's something as simple as going for a walk or do yoga, but some people, when they're really not well, are not able to do any exercise. But if you could, anything, even in a few minutes a day until you feel better, it's just, again, it helps bring up the mucus, and you just feel so much better. And exercise is so beneficial for our mental health as well as our physical health. We just have to try to strengthen ourselves and just improve the muscles. Any exercise improves the muscles, which will increase our chances of being healthier. You don't have to go to a high-tech gym, or you just need to have some type of exercise plan in place, and it'll help in the long run. And when you go to pulmonary rehab, that's basically what they teach you, is some basic exercises, and then they review about other things that'll help you keep as strong as possible. And that is really important.
That's some really fantastic advice you gave there. Everyone, get out there, get moving, stay moving, keep moving. So it sounds like walking is certainly one of your favorite activities, way up there on the list. Are there any other exercises that you might recommend people with bronchiectasis try to find something that they might enjoy doing a little bit more than walking, or maybe some exercises that they'd want to stay away from?
Well, I do yoga in the morning. I used to go to a yoga center, but since the pandemic, I haven't, or watched some yoga. Some of the poses that they do, it's hard for some people with any respiratory or any other medical issues. But just basic light weights, basic calisthenics. There are so many different forms of exercise. There are so many videos out there on YouTube. So you have to find something that you will really like, just to stretch your body. Or even, there's even chair yoga that you could go on Zoom, or just basic, just upper extremity exercises that an occupational therapist can help you with, and a physical therapist. And if you have insurance, and if you really are in need of help, supervision, then some companies do cover pulmonary rehab to strengthen you if you are in a decongestion state. But there are tons of online programs, and I know COPD Foundation has done many videos, and bronchiectasis and NTM will be doing a lot more videos in the future, just to assist people at home. That's the positive thing about this pandemic, that there's so many videos now, and Zoom and other programs that weren't available in the past. So if there is a will, there is a way. So even if you exercise 5 minutes a day and work it up to 20 when you're up to it, and if you don't feel good, give yourself a break. You don't have to feel bad if you don't, because there are days when weather affects people. The humidity, the rain, and other variables may affect your energy to do so. So on the days that you can, just do what you can and just believe that it's going to help you.
Absolutely. As a respiratory therapist, I also can't say enough good things about pulmonary rehabilitation, whether it's a virtual program, whether it's one you can get to in person again in your area. Anyone with bronchiectasis, COPD, any of these associated lung conditions, it's really something I would throw my vote in there to encourage you to seek these out. They're just fantastic programs.
Yes, and it's the community support too. Years ago when I was first diagnosed, I was there and I was the youngest person in the place. But anyway, I put on a yellow sweatsuit and got myself motivated, and everybody else did black. But you have to do what you have to do. Was determined to feel better and get well. I had goals to achieve, and there was a time that I couldn't walk far, and now I can walk far. So you have to believe that you are, as they say, the driver of your own destiny. So we want to encourage everybody to get up and get out there and do whatever you can.
Absolutely. So, going along with exercise is, of course, nutrition. I was wondering if you would share with us any tips you might have for maintaining a proper weight, or again, if there are foods that maybe people should avoid because they can increase mucus, or foods that help support clearance. Basically, just any of your general nutrition tips for people living with bronchiectasis.
Okay, a well-balanced meal, and I know everybody heard that from their mother when they're growing up, but right now it's really important, and the right mix of foods. It helps you to breathe better. And I mentioned the right mix of foods because there was a time that I was eating the same foods over and over again, and I didn't realize, sometimes we eat things that are easy to prepare, so it doesn't take a lot of time and energy. But if you don't eat a balance and a variety of food, you could become nutritionally deficient. And many of us have baseline nutrient vitamin D deficiency to begin with, which affects our immune system. So I would highly recommend check your vitamin D level on a regular basis. And there's a list of vitamin D foods online. I would stay away from, there's a list of inflammatory foods. And one of my favorite is ice cream. And I know once in a while we have to allow ourselves to eat whatever we want, but they say that some people should stay away from inflammatory foods. Some patients can take dairy, and others say it causes increased mucus. It varies from individual to individual. Many patients have comorbidity of GERD, acid reflux. So it's really important to watch the foods that aggravate acid reflux, which include red sauce, high acidic, fried foods. And again, we can't, turn our lives around totally and say, oh, never, ever.
You've talked a couple of times about the importance of preventing problems before they arise. Outside of things like the airway clearance tools you mentioned, or making sure you're getting enough exercise, what are some other things that you've had to do in order to minimize your risk of these symptom flare-ups?
All right. Very important thing, vaccinations, the flu, pneumovax. I think we have all learned about infection control precautions in the past few years, unfortunately, due to the pandemic, and most people were never aware of the details other than hand washing. But going forward, when you go into doctor's office, continue to wear the mask. Um, in the home, we don't use humidifiers. Uh, it is really important to keep your environment as dust-free, mold-free as possible to avoid secondhand smoke, not be around, toxic chemicals or heavy-duty perfumes, not be in really crowded areas because we're more prone to get infections because, as I said previously, our cilia doesn't work like a normal, I don't know what normal is, but like others.
Hmm. You've mentioned an action plan a couple of times now, and an important component of many action plans is kind of learning the early warning signs of one of these symptom flare-ups. What would you say are some of the most common things that could be these kind of early warnings or triggers to let somebody know that a flare might be on the way?
Some people get a sore throat. Some people get more mucus. Some people just get more tired. Some get fever. It varies. You just don't feel right. A lot is fatigue and just the excessive mucus, and you just feel like something's coming on. And just be under the care of a good pulmonologist. And I really stress pulmonologist and not just a regular MD if there's a pulmonologist in your area, because they really need to understand bronchiectasis and recurrent infections and be there for you and educate and keep good track of your challenges over time. So it's best to have one that you will stick with, and that'll be there for you. And if they have questions and they don't understand, then they refer you to another research facility if they're not equipped to deal with your particular case. But it's really important to have someone that really understands bronchiectasis and some infections that are very common in a bronchiectasis patient. Again, we're here to support you to try to be on the path of lesser recurrent infections and to have a good quality of life through education and empowerment, and just to learn to advocate for yourself and just get the help you need.
All right. So if you are interested in getting some additional information about getting involved or support or really any other topic about bronchiectasis, I'd invite you to check out www.bronchiectasisandntm360.org and check out the variety of educational materials we have on the site there. While you're there, you can also sign up for Bronch and NTM 360 Social, our social network for people living with bronchiectasis, including caregivers, healthcare providers, basically anyone who may encounter bronchiectasis can be a part of this community. And the people there are absolutely willing to share their stories, share advice, and help you along your journey. So with that, Katie, I want to thank you very much one more time for sharing your experiences and your wisdom with us today.
Thank you, Mike, for having me.
It was fantastic to have someone who's living the journey themselves, really able to speak from the heart, as you said, and really share your story. Hopefully encourage a lot of other people out there living with bronchiectasis to stay active, get engaged, and really live their best lives. And with that, I would also like to thank you, the viewer out there, for spending part of your day here on World Bronchiectasis Day, watching our program here. Thank you very much. Take care of yourselves. Take care of each other. We'll see you next year on World Bronchiectasis Day 2023.